I've been a pediatrician for over 25 years. And since the start, I have been a focus of my career being on how can we make healthier kids. We now have an opportunity over the next decade to really make a difference, not just in this upcoming generation, but for future generations to follow. So let's talk about it. Hi, everybody. I'm Dr. David Berger, a board certified pediatrician in Tampa, Florida. I have been focused on preventive health and how to raise healthy kids since the beginning of my career, and certainly when it comes to functional medicine, looking for the root cause of issues, but also how to prevent those things from happening in the first place can make a tremendous impact on the health of children as they get older. Now, back in 2012, I wrote a paper in Autism Science Digest that was published called From Preconception to Infancy: Environmental and Nutritional Strategies for Lowering the Risk of Autism. And in this, I talked about the different approaches to nutrition and environment, of course. But this really took off and was read at governmental levels. In China, they started opening up clinics based upon this, and it really has made its way to very understood that this can be very helpful for a lot of people. A couple years after that paper, I was invited to be a leader of a think tank out in Portland for P2I, Preconception to Infancy, which really focused on the science as well as the implementation of strategies to help improve the lives of kids and to make things better for everybody. Now, for many people, we know that inflammation and toxins cause cellular damage. In fact, for all people, just some people more than others. And we know that we can reduce these issues by having clean food, clean water, clean air, and clean supplements. Also, super important to this is the not just the cleanliness of our food, but the health of our microbiome, the flora that's in our gut and our mouth. So, as far as P2I goes, fast forward to this decade, and what we've been really focusing on is the 1300 days, the year prior to conception, during the year of pregnancy, and for 2 years afterwards. Ideally, we would like to help people before they even get pregnant to have the most optimal clean womb, clean nutrition, etc. So, realistically, though, even though the P2I focuses on those first few years, it's really again forever. And so this is almost like a P2I plus type of situation where we realize set things right at the beginning and we can make a big difference in the long term. And so this is what I've decided really to dedicate the rest of my career to, whether it's through public service announcements, speaking out to the media, making videos, medical education, parent education types of videos, really to whoever will listen. So I really think it's important that we need to spread the word, even here on YouTube and elsewhere, to get the algorithm going. So if you're not a subscriber, please do so. Like this, please. But more importantly, share this with other people who you think would find this interesting. We really want to grow the chapter because we know the more views we get here, the more it's going to get out to everybody. That's really what our goal is here, to help everybody raise the healthiest children that they can. Now, furthermore, because of the things that have been going on at the federal level, we really do have an opportunity to make a big difference because I think there's going to be a lot of governmental support. I think that it would have happened regardless of who had won the election, but I do also think that if RFK Jr. is in a position of leadership when it comes to health and has the opportunity to do the things that he's talking about, like cleaning up the food supply, cleaning up the air supply, of minimizing all the toxins that people are exposed to, that's pretty nonpartisan. I know that some things that he said maybe not be considered nonpartisan, but when it comes to the health of children and all the clean lives that we can raise, exercise, other lifestyle, good sleep, that's a universal thought. And I think that he has a real potential to make a difference in this area. Now, in terms of some of the societal trends that I've even seen over the last 30 years, which is why I'm optimistic about this, take breastfeeding, for example. 30 to 40 years ago, while it was talked about, it really wasn't a universal thing. It was taught to us in medical school, and we started telling people, but now this is really standard of care. Now, almost every one of my patients is starting off breastfeeding, most of them past 6 to 12 months, even longer than that. But that's not just for me as a holistic pediatrician. I'm hearing that all over the place. This is a really big drive that was put forth by the Academy of Pediatrics, and now it's something that everybody knows about. Antibiotics. Again, 30 to 50 years ago, antibiotics were being given out by pediatricians, emergency rooms, as if it was water. There was no evidence that there was a bacterial infection, but here's an antibiotic. Now we know better. Now we know that when kids are given antibiotics, we know that it can disturb the good flora that's supposed to be there. And that can facilitate bad things from growing in, like yeast or certain bacteria that can have short and long term implications, not just on the gut itself, but on our inflammation and our brains as a overall. So again, super important. And again, people now realize that antibiotics are being useless, but still about 60% of antibiotics that are ordered for children in America were not necessary. They weren't really bacterial infections. So that's again education in process, but we are doing better. Vitamin D, another great example. Um, I've been screaming about vitamin D for 15, 20 years now. It is standard of care for breastfed babies to be given vitamin D since it's one of the few nutrients that's not overly present in breast milk. Something that I check at a year of life on everybody to make sure they have a good level. But this has also become a more mainstream thing. And certainly it picked up a lot during COVID when it was recognized that good vitamin D levels were protective against more severe types of diseases, both in adults as well as in children, although we certainly learned that COVID wasn't a big deal for most children. But in terms of COVID itself and some of the changes that we've seen over the last 5 years, of course, there was a lot of ambiguity, uncertainty when this all started off, which makes sense. Nobody knew anything about this virus because it was a novel virus. Nobody had ever seen SARS-CoV-2 before. Now, certainly people became aware of the importance of good lifestyle, good nutrition, good vitamin D levels. And we also know healthy people are just less likely to get sick. If you have a good vitamin D level, good zinc level, avoiding sugars, avoiding ultra processed foods, it's going to make a big difference. And that's now is being taught more and talked about at the physician provider level, even though it was there in the patient slash community level for longer. Now, of course, with people seeking out approaches that are alternative and treatments, which happened a lot during COVID, there was some good, bad, and ugly about that. Certainly, again, the vitamin D and zinc. And of course, if you've been watching this channel for a long time, I'm going to sing about that forever. But, there was also, it was good because it did bring about more independent thinkers. I think it was ridiculous when parents, if somebody said, I wanted to do my own research, and they were scorned for that by a lot of the establishment. Who knows a patient, who knows a kid, who knows a person themselves better than a parent, than a person? So I think that was really great. But also, there was a lot of misinformation that went on there, or overstating what is actually known. And an example of that, you may have heard about people who, when it was talked about, giving bleach to somebody, that was a real thing. That wasn't something that was made up or someone just talking off of the cuff. There was a product called Miracle Mineral Solution, which was a form of chlorine that, when ingested, got turned into an environmental type of bleach, and it really injured some people. Now, I knew about this because even before COVID, about 10, 15 years ago, there was a similar misinformation going around in the autism world, and that this product was curing people of parasites, that people were seeing parasites leaving their kid's body. It was wonderful, but some kids started bleeding, some kids started getting very sick. And it was discovered when these parasites were looked under the microscope from the gut in the stool passage, they weren't parasites. It was strips of the lining of the intestinal tract that were just being stripped off by the bleach. So, you know, you have to make sure that you're listening to right sources. You can't just be taking something and hoping it's going to be right, because sometimes it's just not. And so again, it's really important that we make sure that the sources that you're getting information from right. And that's why I'm doing these channels and talking, to try to get the record as straight as possible, at least from how I see it. Now, in terms of the exposures themselves, so clean air, of course, we all know all about pollution and exhaust and all the other things, pesticides that are put up into the airs, especially when people live closer to the places where those things are more. Clean water, we know about the plastics that have been in there. Heavy metals can be in there. The question now about fluoride, which I think is going to be looked at a lot more in the next few years. For me, it's a bit of a mixed bag. I am not concerned. I'm not convinced, I should say, that at this point that the amounts that most kids are getting is a problem, but I think that some people are. I do hope to get this figured out. I think it's an important piece of information, especially if child development is potentially at stake with it. Now, not just that, but we've seen the BPA's, the PFAS, these forever chemicals that are coming off, the microplastics, the nanoplastics. It's because we have tainted food, tainted water. And we need to do a significantly better job in cleaning all that up if we want to make healthier generations. Even the lunch food, Lunchables, which is something I talked about a few months ago, where they found that the ones that were in schools had more lead and and salt in it than the regular ones that were being sold in the supermarkets, to the point where the manufacturers, Kraft, just took those two products out of the schools. They're no longer going to be selling it. I don't know if it's because they realized it was bad or because nobody wanted to buy it because they heard it was bad, but nonetheless. So where is this all going? So fortunately, at the international and federal levels, things are being seen differently. We are seeing in other countries them taking up the mantle for these things. So for instance, P2I has now gone global. The International Federation of OBGYNs has taken it on a standard of care to make sure that there's clean food, clean supplements. Again, other countries. Organizations such the American Academy of Gynecology Obstetrics, or Obstetrics Gynecology, the nurse practitioners, the midwives, they are all learning about this now too. They're asking for certifications for this, and we're helping put that together. Really, just in terms of even working towards cost-effective tests for people to know, do they have toxins in their body? Do they have enough nutrients in their body? There's now being developed single blood drop, single urine drop that can be done at a fraction of what the cost that it's being done at regular labs right now, that could potentially be used all over the world. And again, for just a fraction, to figure out what the problem, who has the problems, or if there's certain environments, certain communities that have the problem. But there has to be this full-scale approach. Medical education classes for providers as well as for consumers. It's huge. And even as I mentioned, the food and supplement testing, there is P2I certification that there has to be certain levels, the levels that were set by the International Federation of OBGYNs, in terms of all the different toxins, pesticides, heavy metals, and of course, accuracy in labeling. One of the prenatal companies that were tested actually had no folic acid in their prenatal, which of course, folic acid, you'd think at least they'd have that. So of course, also, this isn't going to just come from the physicians, because we know that younger people are more savvy. The parents are more savvy. They're getting more information from social media, and from networking. And again, hopefully they're going to get it from good sources. So in general, this is the time for change. It's here. I think that we have great momentum to truly, truly make a difference in millions of people's lives. So of course, hopefully the sourcing that you're getting is credible. And yes, spread this out. Let this other people know about it. But I'm not giving up on this. I know we can make a huge, huge difference. Have a good day.